Since the 1973 Roe v. Wade decision to legalize abortion, it has been a hot political topic for the country. And more recently, talk of defunding Planned Parenthood has become a rallying cry for pro-lifers and a concern for women who cannot afford to see a regular OB/GYN.
So I think the good next move would be a total defunding of Planned Parenthood at the federal and state level. Because by continuing to fund the organization, the government tacitly is keeping them afloat and also keeping them being able to expand, because they're getting all this money from the federal government, so they don't have to rely on just private donations.
Some politicians try to prove that Planned Parenthood uses government money for abortions, but legally they can't. A 1976 amendment to Roe v. Wade, called the Hyde Amendment, prevents family planning services from using any government funds for abortions unless it is a case of rape, incest, or if the mother's life is at risk.
Planned Parenthood has received an overwhelming support of donations in the past couple of months, and we are so grateful for those donations because they allow us to help pay for medical services, education programs, and our advocacy efforts. But while donations are extremely important, it's not sustainable. So if Planned Parenthood was not able to get reimbursed through health insurance or Medicaid, we see too many patients to only rely on donations.
According to its most recent report, Planned Parenthood got $553.7 million from federal, state, and local governments, and around $775 million from non-government sources. Most government funding to the company comes from Medicaid. Trump's legislation doesn't affect Medicaid money, but allows states to withhold Title X, or family planning funding, which makes up about 20% of the company's funds. Planned Parenthood has over 650 centers nationwide and claims that only 3% of its services goes towards abortion. 42% of its services goes towards the screening and treatment of STDs, which can happen at buses like this one. And 34% of its services goes towards contraceptive care.
In about 113 counties across the United States, Planned Parenthood is the only reproductive health care provider in those counties. So people will not have other places to go to get quality, high quality, comprehensive reproductive health care services.
President Trump does not have the power to single-handedly defund Planned Parenthood. Doing that would require 60 Senate votes to change a law that allows Medicaid recipients to choose any qualified provider they want. Considering the Democratic filibuster of this movement, that prospect does not look likely in the near future. For Stony Brook News, I'm Rebekah Sherry.